Okay, I want to finish up our gastrointestinal PowerPoint videos for you, and then we'll head on to the genitourinary. But let's talk about some conditions today. We've already talked about word roots and prefixes and suffixes. We've already gone through vocabulary, so hopefully you've gone through those two videos already. And I just want to finish up and tidy up the last bit with a little bit about conditions. So let's talk about conditions. A couple conditions here. First of all, anorexia. And this is basically involving symptoms that we get of the GI tract. And some of these you probably are familiar with, obviously, even I've probably experienced with. We won't talk about that. But anorexia. Anorexia is just another medical term for the loss of appetite. So when somebody has either an illness or something like that, or where they don't have any appetite, when their appetite is no longer there, it's called anorexia. Okay. We know or have heard of anorexia nervosa, where what happens is sometimes people refuse to eat just because for some reason psychologically or they realize that they think food might be detrimental to them, then they just don't eat even though they need to, which could be pretty devastating, which may actually result in death in some individuals. But anorexia basically is a medical term that means a loss of appetite. Ascites. If you ever looked at the pictures of like some of the kids like in Africa in these famine-stricken areas where they drop like rice and stuff like that, you see these little kids that run on the street and they have really spindly arms. Looks like the arms and legs are just like bones with very little muscle on it. But if you look at their belly, they have these huge bellies. Okay, huge bellies. And the reason why they have that is not because of their eating, it's because of not eating. Most of the food drops that they get are things such as starches like rice and stuff like that could last a long time. Well, the thing about it is there's a very essential protein in the body which is called albumin. Okay, it's made in the liver, and this albumin is important because what it does is it actually circulates around with the blood and holds the liquid, holds the water in the blood itself. Okay, so it draws the water portion of the blood in there, so that when we look at blood, there's cells like red blood cells, white blood cells, and things like that, but it's floating around in a liquid medium. To hold that fluid in, you need this protein called albumin, which circulates around the blood. What happens is, to be able to make protein, for the body to make protein, it has to eat protein. And when you eat a protein, it's broken down, like we talked about in an earlier thing, into such small things called amino acids. And the amino acids go into an amino acid pool in the body. So when I'm making the protein, then the body could dip into this amino acid pool and then make the protein, which is basically what we say in our DNA. Our DNA has the recipe for making all these proteins. Okay, so what happens if somebody's diet is protein deficient? In other words, they have no protein in their diet, and all they get is, because of the famine, rice drops and things like that, and a lot of starches. They don't eat the protein. The body eventually wastes and they lose all the protein. The reason why the muscles are gone is because when the body needs to make more protein, it takes some of the protein that the body has in muscle and things like that and destroys it to try to make protein for body processes to occur. So anyway, what happens is now if we're not able to make this albumin because I can't make protein because the diet is totally deficient in protein, there's nothing to hold the fluid in the blood vessels. Okay, and the fluid portion of the blood will leak out. Well, one place it leaks out is in the belly. So when we see these large, huge bellies, it's not because they have a lot of fat in there or anything there, but the whole abdominal cavity, the whole peritoneal cavity, is filled with fluid. Why? Because there wasn't the albumin to hold the fluid in the vessel, in the blood, to keep it, and it leaks out through the walls of the blood vessels to the capillaries, and it gets into that abdominal cavity, and that's called ascites. That's called ascites. If they take a needle and stick it in the abdomen, they draw it, it'd be just all kinds of fluid that's in there because of that fluid that's lost from the vascular system into that abdominal cavity, and that's called ascites. People who have liver failure, it's the same thing, because liver is the place where the body makes albumin. If the liver's failing and it's not working, it can't make albumin, therefore it can't keep the fluid in the blood, and as a result it leaks out, and that's why also people with liver failure with these big bellies as well, and that's called ascites. Okay. The treatment for that is basically keep on drawing the fluid out, but it's going to keep on coming back simply because there's still nothing holding the fluid, the liquid portion of blood in the blood. And as a result, what happens? It's dietary changes that will make the difference. Borborygmus. Borborygmus is that gurgling sound that you hear in your stomach. Okay, and basically the borborygmus is basically what happens is there's nerves in the wall of the small intestine that will fire to try to move things around. Well, what happens happens is inside our small intestine, inside our large intestine, it's a combination of two things: liquid material, which is the stuff that's being digested and absorbed and stuff like that, and also gas. So as the intestine squeezes, it's forcing this column of fluid and gas around, which then causes this sound, which is called borborygmus. Okay, so when you hear those the gurgling sounds, you could always tell your friends and family, hey, my borborygmus is acting up now, and basically they won't have a clue what you're talking about, but you know, and you'll feel a little bit more important. Okay, so that's borborygmus. Constipation. Do I really have to explain what constipation is? Constipation is basically inability or the retaining of fecal material, and one of the biggest reasons why it happens is because the major thing that happens in the large intestine is fluid absorption. Once the material gets to the small intestine and empties into the large intestine, that area of the cecum we talked about before, which you should know by now, empties into the cecum, what happens is there's still a lot of fluid. It's still liquid. It's totally liquid. It's a soup. Okay. Well, the problem is, as we go through the large intestine, we don't want this soup to just stay there all the time. Okay, so what happens is the large intestine, the biggest responsibility is to start to actually take the fluid out of that fecal material to make it more formed. What happens is sometimes the body needs more fluid, so it absorbs more from that material. Therefore, the stools become hard, bulky, and are more difficult to pass. And that would be what we see with constipation. Sometimes it's because the muscles that don't work as well, but constipation is what we see there. On the opposite hand, with diarrhea, now instead of having formed stools, you end up having a lot of liquidy stools. And the reason why the liquidy stools occur is because in the lining of the colon is inflamed, and because it's inflamed because of an intestinal flu or something like that, or some type of a reaction to something, a bacteria in the food, which it refers to as food poisoning and stuff like that. What happens is now that the inflammation of the lining of the colon prevents the colon from being able to reabsorb that fluid. As a result, the fluid stays with the fecal material and comes out, so the fecal material is very watery and liquidy. Okay, and that would be what would happen with diarrhea. Dysphagia. Okay, dysphagia is the difficulty swallowing. Okay, when people have a dysphagia, what happens is they may chew things, they may have them, but what happens is they have a difficult time swallowing, and that's what dysphagia would be. Bad, difficult, painful. Phagia. Phagia means eat. Means eat. Phage, P-H-A-G-E, or P-H-A-G/O as a word would mean eat. So dysphagia would be the difficulty eating, which is actually the difficulty swallowing. So when you hear the word dysphagia, that's what it means, that they have difficulty swallowing. Irritation, simple word and simple way to describe irritation is a burp. When I have to have the gas in my abdomen, what happens is sometimes it has to be brought up. When it's brought up, that's called irritation. Sounds a little bit more polite. And on the other hand, flatus is just passing gas out the other end. Okay, so when someone is flatulent or has flatus, it means they're passing a lot of gas through their rectum. Okay, the last word on this symptom list is hematochezia, and hematochezia means bright red bloody bowel movement. So when somebody has some type of a condition with hematochezia, it means that their bowel movements are bloody and they're bright red and bloody. Okay, people with like ulcerative colitis, because of the inflammation of the colon, because colo means colon, what happens is they pass a lot of blood in their stools, and the stools are bright red, and that's called hematochezia. So that would be hematochezia. So hopefully those words now make a little bit more sense to you. Couple other symptoms: hemonemesis, where hematochezia is bright red bloody stools. Hemonemesis is vomiting blood. Now, vomiting blood could be one of a couple different ways. Sometimes we have a lot of rapid bleeding in the stomach, or in the upper GI tract, and when it comes up, it comes out as bright red blood. Sometimes what happens though is when the blood is maybe a little bit slower, or if I have a little bit less, it's more of a trickle or something like that, the gastric acid starts to digest the blood that's inside the stomach. And what happens is the blood starts to clump up, starts to turn dark and dark brown, and starts to clump up. And what happens is sometimes you'll see these people with bleeding in the stomach from like a small bleeding ulcer or something like that. They have what's called coffee grounds emesis. and because emesis means vomiting. Coffee grounds emesis means that when they vomit this stuff up with all the clumped up little clots of blood in there, they're very small. It looks like a wet coffee grounds, like you get out of a coffee filter in a coffee pot. So that's called hemonemesis. Either bright red blood that people will vomit, or this a darkish coffee grounds emesis. But hemonemesis just means vomiting blood of one form or the other. Jaundice. Another name for jaundice that I think you should remember is icterus. Icterus and jaundice mean the same thing. If someone's icteric, it means they're jaundiced. If someone's jaundiced, it means they're icteric. Okay, and basically what happens is we talked about that material before called bilirubin. If the bilirubin either can't be handled by the body correctly, or if it builds up in too much of an amount, it gets in the circulation. As it gets in the blood, we know that bilirubin is a brownish, yellowish pigment. So what happens is, as this pigment gets switched around the blood, we know that bilirubin is actually the basis of what we see with bile, which is stored in the gallbladder, like we talked about before. But as that bilirubin gets around the circulation, it starts to leak out of the blood vessels. And as it leaks out of the blood vessels, it deposits in the skin, which causes that yellowish discoloration of the skin, the whites of the eyes, the roof of the mouth, things like that. Those areas become very yellow, and that's called jaundice or icterus. Okay, so the idea is when somebody has jaundice, then the determining factor is, why is it there? What is it? Is it a liver problem? Is it a gallbladder problem? Is it whatever the case may be? So there could be lots of different reasons why people have jaundice or icterus, but that's just that yellowish discoloration of the skin because of accumulation of this thing called bilirubin that's in the skin. Melena. If somebody is having bleeding in their upper GI tract, again, I talked about coffee grounds emesis, where it starts to be digested. If it continues on through the GI system, what happens is a lot of red blood cells are broken down and the protein can be reabsorbed, but the iron stays with the fecal material, okay? And iron will have a tendency to discolor the fecal material exceptionally dark brown to black. Okay, if anybody's ever taken iron as a supplement for something because of iron deficiency anemia, they know that their bowel movements will change. They become darker and blacker and almost granular in some situations. So when people have melena, it means black, tarry stools. And the reason why they're black and tarry is because now there's bleeding somewhere, and that bleeding has been digested. It leaves the iron in there, and that iron it will stain the fecal material black. So as a result, the melena are black, dark, and frequently tarry-like stools we have, and that's called melena. Usually means that there's bleeding somewhere in the upper GI tract that the blood is continued on through as things get absorbed. Okay, nausea. Nausea is uneasy feeling, a sick to the stomach type feeling, which may result in vomiting. Everybody knows what nausea is. And steatorrhea, we've mentioned before. If the body doesn't handle fats very well, such as a gallbladder problem, what happens? More fat stays in the fecal material, and as a result, as the material goes through the intestine, finally becomes eliminated with defecation. If the stools are fatty, this is what we call steatorrhea. So fatty stools. The name steatorrhea is a word that means fatty stools. Well, how do I know they're fatty? Because what happens is fat is lighter than water. So steatorrheic stools, the fecal material will actually float on the top of the water. Okay, because it's lighter. Also has a tendency sometimes to be a little bit more bubbly and stuff like that. So anyway, that's steatorrhea. Steatorrhea means fatty stools. Some oral conditions, aphthous stomatitis. You ever have that little canker sore in your mouth? The name for that, the medical term for that little canker sore is aphthous stomatitis. A lot of times it's because of the mouth has a lot of bacteria and virus and stuff like that there and there all the time. So sometimes it's because of a bacteria or a virus that would cause a problem in there. Other times it's just because of pressure, like from the tooth or something like that. And that would cause these little ulcers. And you look at the little white pale ulcers with a little red ring around it. That's just called aphthous stomatitis. Some people have one, some people have many. You know how uncomfortable they are. I remember seeing a girl a long time ago when I was a PA before I went back to school again, and her whole mouth was filled with aphthous stomatitis. She was actually admitted to ICU because they had to have someone suction her like every couple minutes because she couldn't swallow. There was so much pain. She couldn't swallow because her mouth was like one big ulcer, aphthous ulcer. So anyway, there are some conditions that may cause that as well besides that, but everybody has an aphthous ulcer sooner or later. And stoma just means mouth, and itis means inflammation. So it's a aphthous stomatitis is the aphthous ulcer. Dental caries is just a medical term for a cavity. So when somebody has a cavity, it's called a dental caries. Herpetic stomatitis. What happens is herpetic stomatitis is the medical term for a cold sore. So when people have these cold sores, you notice they don't just have one. It'll go away, and guess what? It's not cured. It comes back again, sometime down the future, maybe months, maybe weeks, maybe years, who knows. They get it. And the reason why is this is what we call herpes simplex type 1. It's a virus. Herpes simplex type 1. And with all this COVID stuff going on, people have to recognize that viruses have never been alive to start out with. They're pieces of RNA or DNA inside a capsule, okay? And that's all they are. What happens is I can't get rid of them. So when people get infected with this herpes simplex type 1, which involves the mouth, not herpes simplex type 2, which involves down below the waist, if you know what I mean. We'll talk about that in the female and male reproductive system. But this herpes simplex type 1 causes these cold sores. Usually these cold sores, if you've had them before, come on when you're under stress, or there's more stuff going on, or you become nervous about something, or you have a lot of work to do. All of a sudden they come on. Or when people are ill, they'll come on. And the reason why is the immune system goes down, and the herpes, which is not a bug, but it's a virus. The herpes says, "Hey, good time to play." They come out and they start to play, and these cold sores come out. When people use the things like Abreva and other things, or acyclovir, which is a medication, or valcyclovir, which you take by mouth, it doesn't cure it, doesn't kill the virus, because nothing kills the virus, because the virus wasn't alive to start out with. But what it does is it may decrease the time that's effective. It may push it back into hiding for a while, and that's called herpetic stomatitis. It's totally different from the genital herpes. They're a different type. They're in the same family, but a different virus. Genital herpes is herpes simplex type 2. Oral herpes is herpes simplex type 1. Okay, oral leukoplakia. Leuko means white, as we know. Well, what happens sometimes, people who are smokers, pipe smokers and things like that, they'll develop these whitish plaques inside their mouth, on their tongue, in the gums, on the back of the throat. And the problem with these plaques, these whitish plaques, is that what happens is they may actually further progress to various types of oral cancers. So that's why smoking, smokeless tobacco, like chewing tobacco, pipe smoke and stuff like that, a lot of these, they will cause that irritation. That irritation causes these whitish plaques, and these whitish plaques may actually cause a change in the cells, which is usually a squamous cell carcinoma. Okay, which in the skin, outside skin, is usually not much of a problem. In the mouth, may be a big problem because of the way it drains. But the squamous cell carcinomas on the inside, which may involve the mouth, the throat, the tongue, things like that. And then people have to have them surgically removed and stuff like that. So that's a big problem. Periodontal disease. Peri means around, dontal means tooth. This is basically when people have a lot of gum disease. Okay, when you go to the dentist, they check your gums. They look and see how much of a pocket you have between the teeth and the gums. The larger the pocket, the more gum disease there is, and that gum disease is called periodontal disease. So that's all that means. So these are some oral conditions that we could talk about. Let's talk about some upper GI tract conditions. Achalasia. Achalasia is a situation where what we find is the nerves that supply the esophagus don't work. So as a result, what happens is when we eat and get that bolus of food to the back of the mouth, it sits there instead of going down, because now the esophagus squeezes to push the food down. You can't feel it, but it happens. There's these little wiggles in the esophageal muscles that actually help to move the food down. It doesn't work. So as a result, what happens is they have a dysphagia from this achalasia, which prevents the muscles from working in the esophagus. That's that. Esophageal varices. What happens if people have liver problems? Okay, there's a large vein, I think I mentioned this before, that drains all the intestines. Okay, we can't say all, probably about 90% of the small intestine and about 50% of the large intestine, and it's called the superior mesenteric vein. The superior mesenteric vein in the abdomen meets with another vein, which is called the splenic vein, and they create one large vein, which is called the portal vein. Okay, well, what happens is in esophageal varices, with cirrhosis, the liver becomes damaged either because of hepatitis, alcoholism, other viruses and stuff like that. And what happens is when the liver becomes involved, or when they have a hepatitis or alcoholic problem with their liver, the liver, instead of getting big, it gets sort of like tight and gets scarred. So what happens is this portal vein, as it comes into the liver, gets squeezed. And as a result, it's like when the heart fails. We talked about the heart fail, how everything backs up behind. Now all this blood that's coming from the intestine with all the nutrients that goes to the liver first, so all the things that are absorbed in the GI tract go from the small intestine, to the liver, so the liver could use it first. All that blood now that's coming through that portal vein into the liver gets squeezed, and therefore all the pressure in that portal vein backs up. One of the places it backs up is in the veins around the belly button, around the umbilicus, around the navel, and they have these veins that come out, and they come out like a starburst in a big like a rays coming out from the umbilicus, and it's called a caput medusa. But caput means head, medusa means Medusa's head, all those, and that's because all those veins get dilated like varicose veins of the abdomen. The second place it causes a problem is in the hemorrhoids. In hemorrhoids, what happens is the hemorrhoidal veins actually drain into this the area of the portal vein, and the hemorrhoids get big. But guess what? We could live with both of those. The problem is with esophageal varices, it's around the lower edge of the lower end of the esophagus, there are veins. These veins also start to dilate. And one of the problems is sometimes these veins around there, because of gastric acid, because of swelling, because of pressure and stuff like that, they will burst. When they burst, they bleed like a fish. They bleed bad, and they're very difficult to take care of. And they're called esophageal varices, or like varicose veins of the esophagus. And they're usually because of liver disease, either hepatitis or alcoholism or something like that. And it can, in fact, be fatal. I do know at least one person who died from bleeding from an esophageal varices. Okay, and that's what that is. And it's again because of liver disease that causes pressure. It's called portal hypertension. That portal vein, the pressure in the portal vein increases, puts pressure back in the veins that drain around the esophagus. Those veins get big, they become dilated like varicose veins, and they may break. Gastric carcinoma just means a stomach cancer. It does occur from a few other reasons, but it just means stomach cancer. GERD, gastroesophageal reflux, you'll hear there's commercials on. What happens is, remember we talked about how the esophagus, the bottom of the esophagus, has a little sphincter. A sphincter, we know as a definition, is a ring of muscles around a tube that sphincter could either open or close if I want to make things go through. Well, at the bottom of the esophagus, we have that lower esophageal sphincter. When I get food into the stomach, that sphincter closes, and it's closed for most of the time unless I want to get food in. And when the food comes down the esophagus, it will actually cause that sphincter to open. The chute opens and allows the food from the esophagus to go in the stomach, and then it closes. The reason why it closes is the stomach is full of all kinds of gastric acid. I want to keep that gastric acid in the stomach. So as a result, what happens with GERD, the problem is that lower esophageal sphincter stays open a little bit. So as a result, the gastric acid could leak up into the lower portion of the esophagus. Well, in the case of during the day, it's not much of a problem. Why? Because we're upright, okay? And since we're upright, the gastric acid is going to sink to the bottom of the stomach. However, where does it bother you most? At night. When you're lying at night, now the stomach is here, the esophagus is going this way, now the gastric acid goes from the stomach into the esophagus, and it causes a burning of the lower edge of the esophagus. And the problem with that is then it causes a chronic irritation around there in that lower edge of the esophagus, which may cause some problems, which I'll talk about in a minute. Okay, so that's gastroesophageal reflux. The treatments now are basically a lot of things like Nexium, Prevacid, stuff like that. And these are things that actually decrease the acid production in the stomach. If I have less acid in the stomach, then less will come up. Also, people, if you know, they have what's called a hiatal hernia, where that ring around the diaphragm with the lower esophageal sphincter is too wide. So a lot of people, what they do is they elevate the head of the bed a little bit, so they sleep a little bit more sitting up. Therefore, gravity doesn't allow that gastric acid to get the esophagus. Hernia we've talked about before. It's a weakness in the abdominal wall, and so therefore with increased pressure in the belly or something like that, the intestinal contents will actually poke out through that weakness in the abdominal wall. It doesn't come to the outside because obviously we have subcutaneous tissue and other material between the outside and that is. But what happens, it causes a bulge, okay, or a bump. And what happens is sometimes that bulge or bump, the problem with it is if the intestine gets caught outside and can't get back in, it sort of like twist ties around that area, and as a result, what will happen is the blood supply to that intestinal part goes down, that part of the intestine dies, which is a big problem. So the idea is they usually go repair these. How they repair that is they go and sew close the gap or the weakness, or sometimes they'll put a mesh in there. I know a year ago last summer I had a hernia procedure done on the right side. I had a right inguinal hernia down my lower abdomen, and basically they just went in robotically. I have 3 little cuts in my belly. They went with a robot, put a little mesh in there, tacked the mesh against the wall, closed the hole, and I'm perfectly fine since then. So that's called a hernia. Peptic ulcer. Peptic ulcer is just a situation where the acid in the stomach will irritate the inside lining of the stomach and sometimes cause this little ulcer, just like those little aphthous ulcers we talked about before. Cause a little ulcer. Okay. Now, again, why doesn't the acid normally irritate and burn the stomach? Because the stomach makes a mucus, and the stomach is lined with this mucus that prevents the acid from actually irritating the stomach. Okay. Now, for this mucus to be made, the body needs a certain chemical called prostaglandins. There are a number of different types of prostaglandins. Well, some prostaglandins cause pain. Some will affect the opening of the bronchial tubes and stuff like that. But in the stomach, these certain prostaglandins actually help to make the mucus. Okay. Well, what happens if you're you're taking like aspirin for a long time, or things like Motrin, non-steroidal anti-inflammatories or something like that? What happens is they block prostaglandin, and when they block prostaglandin, they decrease the production of the acid in the stomach. Okay, and therefore now there's nothing to protect the stomach from the acid, and the acid burns. So that's why they tell people when they're taking like anti-inflammatory medications for a long period of time, either take a Nexium or Prevacid, Prilosec with it, or don't take it too long, because it actually decreases the production of the mucus in the stomach, which then causes an irritation of the lining of the stomach, either a gastritis, gastric stomach inflammation, or an ulcer. The problem with the ulcers is that if the ulcer is in a place where there's close to a vessel, it may cause that vessel to burst. It may cause some bleeding in the stomach and all kinds of other things like that. So that's peptic ulcer. Barrett's esophagus. Now let's go up a couple. Let's go to gastroesophageal reflux disease. What happens is at the bottom of the esophagus, there's actually a little red line. If you look down, well, you can't look down there, but if you had a scope and you look down there, you see right at the bottom of the esophagus, there's a little red line that divides the stomach from the esophagus. Okay, it's called the Z line or the dentate line. And it's a spot where the cells change. The cells on the top are very much similar to the cells in the inside the mouth. The cells below that line in the stomach are glandular cells. Okay, so as a result, what happens is there's a normal, nice, easy line. However, if I have a situation such in GERD where acid leaks out of the stomach and gets into the esophagus, it burns that area of the esophagus, and it actually causes the gastric cells now to cause a change in the cells in the lower portion. Let me put it this way: the cells in the lower portion of the stomach, or lower portion of the esophagus, now look a lot more like the gastric cells. And when they look down there, instead of seeing a nice red line, they have this wavy line that's down there, or with big tongues of abnormal tissue. So what Barrett's esophagus is, it shows that there's actually some abnormal cellular degeneration that's occurring in the lower esophagus. Well, why is this important? Because what happens to Barrett's esophagus is actually a precursor to esophageal cancer. Okay, and I'll talk a little bit more about esophageal cancer in an upcoming slide. So it's at one step just before. So if they could find somebody who has a Barrett's esophagus, then the idea is they might be able to take care of it before it becomes cancer. So that's called a Barrett's esophagus. Anal fistula. A fistula is an abnormal tube. Some people with certain types of things such as Crohn's disease, and we'll talk a little about Crohn's disease in a couple words down. What the Crohn's disease does is it actually causes inflammation. It causes little channels that will go from the bowel to the outside, and these are called anal fistulas. So instead of the fecal material just coming out the anus, it comes out these little channels that might be all around the area. In fact, might be even higher in the buttock region, where these little abnormal channels are making their way out, and they'll drain fecal material, and they're called anal fistulas. Okay, so that's one of the things that we see with things such as Crohn's disease. Colonic polyposis. A polyp is like a little a punching bag hanging from the wall of something. Okay, what happens is, the reason why we worry about colonic polyposis is the polyp is not perfectly normal, and as a result, that polyp may actually degenerate into a cancer. Okay, The chance of that happening for a single polyp is very low. However, if I have lots of polyps, okay, it's like buying more lottery tickets. Your chance of winning is still low, but you still got a more chance. So colonic polyposis is something that they look at for people, because if they have all these polyps, there's a greater chance that, at least if there's more polyps, there's a greater chance that at least one of these may actually start to degenerate and become cancer. Colorectal cancer is one of the largest leading causes of cancer deaths in the United States. We're seeing it going down a little bit, and the reason why we are is because people are more commonly involved in screening, either colonoscopy. I know my mom died of a colon cancer in 1991. And I go for a colonoscopy every 5 years. I go more than normal. Usually they say at about 50 years of age, 45 to 50 years of age. 40 years of age if you have a family history, 50 years of age if you don't. You should probably have a colonoscopy like every 10 years. But I get one every 5 years because my mom died of a colon cancer. And basically what happens, it's a cancer on the inside of the colon. Could be from a lot of different reasons. There's all kinds of different. My mom's type of cancer was a very unusual type of cancer. It's not the usual typical type, but it's just cancer of the colon. But we have either colonoscopy, if you see it on TV, that 1, 2, 3, they have the little box that's sitting on the toilet, detect most colon cancers because of fecal DNA. Yeah, they do. So there's lots of more tests that they have now. They're able to surveil and to actually watch people to see if they do have colon cancer. Okay, so that's colorectal cancer. Crohn's disease. Somebody in the class may know somebody with Crohn's disease, maybe a family member, relative, friend, something like that. It's not an uncommon thing. And what Crohn's disease, it's an autoimmune disease. For some reason, my body looks at the inside lining of my intestine, whether it be and from the Crohn's disease all the way from the colon all the way up to the mouth. It could be anywhere. There's usually a common place where it is, but it could be anywhere along the GI tract. And what happens is the body recognizes this as being abnormal and actually sends cells to destroy it. Okay, so it starts destroying some of the walls. It creates an inflammation of the wall of the intestine. And the problem with Crohn's disease is, as this happens, it keeps on building up in thickness because the wall gets inflamed and may actually cause the intestines to block off, which then results in intestinal obstruction. Okay, so Crohn's disease is really common. And if you look at the people like on TV when they see the commercials, living with Crohn's disease, what happens is a lot of these people are taking what are called biological agents. If you look, Humira and stuff like that. Look at the commercial next time you see them talking about Crohn's disease, and you might see something in regards to taking a biological agent. What the biological agent does is it actually decreases someone's immune response. So it makes them more, and you also say if you have TB or something like that, tell your doctor. Why? Because those things that will weaken your immune system may actually cause more of a problem. Or the things when you take these biological agents like Humira and stuff like that, which can be helpful in things like Crohn's disease or ulcerative colitis, which are both in the same thing. They're called inflammatory bowel disease. When you take these biological agents, by decreasing your immune system, it makes you more vulnerable to getting other things. Okay, the tuberculosis may become activated, like we talked about, or it may cause other things to happen. So that's why they don't always give it to everybody. Okay, so anyway, that's Crohn's disease. It's autoimmune, involving anywhere along the intestinal tract, usually at the area where the small intestine meets the colon, at that ileocecal region. That's the most common area. Okay, diverticulosis and diverticulitis I'll take together. If I look at the wall of the large intestine, has these pouches. There's normal pouches, and if you take an A and P, these are called haustral pouches. They're little pouches, and they're because there's a muscle that runs the whole length. There's 3 little muscles that run in a line the whole length of the large intestine, and it almost like pulls it together to create like a bunching. Like if you did a hem in something, and you pull the string on the hem, you get bunching. Okay, and it causes these little pockets. Well, these pockets are supposed to be there. However, sometimes the wall inside one of these pockets becomes a little weak, and we have a pocket on top of a pocket. In other words, we have that haustral pouch, and then out of that haustral pouch, I have another little pocket. That other little pocket would be called a diverticula. Now, it commonly occurs in the colon, but it could occur anywhere in the GI tract. I have a little duodenal diverticula. When I had an esophageal gastroduodenoscopy, they looked at my upper GI tract, and I had a little diverticula in my duodenum, which just things get trapped in there every so often. But in the colon, what happens if it gets trapped in there, with like seeds, nuts, shells, things that don't digest, they get jammed in this little pocket off that pouch, and as a result they sometimes get inflamed, and that would be called diverticulitis. And sometimes that diverticulosis may actually bleed. Dysentery. Dysentery is a diarrheal disease, and there could be a lot of different reasons for dysentery. There's different types of bacteria as well as viruses that cause explosive diarrheal disease. Now, the problem with diarrhea is that obviously you can't spend your whole life sitting on a toilet, but the idea is what happens is, again, if I take that inside the colon that becomes inflamed and I don't absorb the fluid, I start to get rid of too much fluid. I can't save the fluid, and people frequently have things like dehydration. That's why you'll see kids that they're like kids who are vomiting a lot and have a lot of diarrhea. You know what they say? Give them Pedialyte, because they take the Pedialyte. It's easy for the GI tract, plus it tries to restore the fluids back into the system. Okay? Or you have people with profound diarrhea. What do? If it's so bad, they actually have to go ahead and put them on an IV just to try to get the fluids back. Hemorrhoids. Hemorrhoids are little dilated veins that are at the area of the anus. Some people think it's because of people retaining stool longer and stuff like that, and that's just called a hemorrhoid. Okay? They're sort of a pain in the butt, of course. That's what we'd say. Ileus. Ileus is a term where we mentioned before that when things move through the intestinal tract, they move because the nerves of the intestinal tract will squeeze. Okay. What happens though is sometimes those nerves stop working for one reason or another, after surgery, after injury, or something like that. And when they stop working, it's called an ileus. What happens is the bowel can't move the material through it, and all sits there and starts to accumulate, and the bowel starts to stretch and stretch and stretch and stretch and stretch, but nothing's moving. It's sort of like a crowded highway with an accident where nobody moves. Okay, and that's what happens with the ileus. If you've ever had surgery where they put you asleep with anesthesia, they don't feed you right a while afterwards. They feed you when you either are hungry, because you could hear they hear bowel sounds, or you start passing gas through your rectum, flatus, so that way they know that the bowel is working. But the ileus is basically where the nerves temporarily become, quote, paralyzed in the small bowel and the large bowel, and nothing moves. And again, what happens is if this goes on for a long time, the small bowel starts to fill up more, and it keeps on going up proximally, and as a result, because everything's coming from the top, if you keep on eating, eventually what happens is people start vomiting, and you don't want to smell the vomit of people who had ileus. Why? Because that vomitus smells just like diarrhea. I didn't ask them how it tasted, but it'd be smelling just like diarrhea, because basically that's what it is, the stuff that's been in the intestinal tract is coming back up that way, and that's called an ileus. A couple other ones. Intussusception. Intussusception is a situation, you don't see it too much in adults because the bowels, think about it is, a lot of times you get things in kids, but you don't get them in adults. Sometimes in the case of the viruses and stuff like that, they get exposed to the virus early, so they get an immunity, a natural immunity to it later on. But what happens is also in kids, the reason why I see some things in kids and not in adults is because kids, all the structures are smaller. So if there's something that causes a problem, it's easier to get obstructed. Or adults, the structures are bigger, so there's less of a problem. So intussusception we see more in kids, and what happens is this is a telescoping of the bowel. What happens is I have the bowel here, and then the bowel should be like this. What happens is this part now gets inside the other part, and another part may go inside, almost like like you see a pirate movie. The guy pulls out the telescope and pulls it out. It's like taking that telescope and now putting it back together and squishing it up. And also one loop of bowel gets in, or one part of the bowel goes inside the other part of the bowel, and another one may actually go inside that. What that does, it takes the lumen or the hole or the opening and squishes it down. So as a result, it's not so open, which then causes obstruction, which causes all kinds of problems. It doesn't happen all that much, and that's called intussusception. Irritable bowel syndrome. You may have irritable, but somebody in the class may have irritable bowel. It's sort of like during times of anxiety and nervousness, guess what? You have a lot more nausea, you may have a lot more diarrhea and stuff like that. And basically, anxiety then stimulates the neural activity of the gut to be faster. The gut moves a lot faster, does things like that, and as a result, because of that, there's a lot more diarrhea, nausea, irritation in the belly and stuff like that. All they do is basically for irritable bowel syndrome, there's no damage. All they do for that is they basically take it, and what they do is they give a medication that slows the bowel down. It decreases that activity of the bowel. Ulcerative colitis. Ulcerative colitis is also an autoimmune disease, very much like Crohn's disease, but ulcerative colitis only involves the colon. Starts at the anus and works proximally. Starts at the anus, works up into the rectum, from the rectum to the sigmoid colon to the descending colon. Very rarely goes past the middle portion of the transverse colon. And basically what it causes is a very superficial ulcer that goes around the whole colon, inside the colon. And as a result, what happens with this ulcer allows a lot of fluid to leak out and blood and stuff like that. And again, they could actually sometimes, if they have an ulcerative colitis, they could actually go in and take out that piece of colon and reattach it. And sometimes that's fine. Doesn't mean that they might not have that autoimmune response somewhere else, but basically that's what it is. Volvulus. Volvulus is basically where the intestine twists on itself. Okay. The intestine is actually, the small intestine hangs from the back wall of the abdomen by a flap of that peritoneum called the mesentery. And the reason why we have that is because I can't have loops of bowel that are just going, free all over the place, because how do I get the blood supply to them? I have to get blood supply to them. The way we get the blood supply to the bowel is through this mesentery, which is like a fan, okay, of tissue, and the blood comes off the aorta and the superior mesenteric artery, the inferior mesenteric artery, in the backside of the abdominal wall, and goes through these mesenteries, and what they do is then it supplies the gut. Well, the problem is, because the gut is freely movable, if that gut actually makes a quick turn and twists, it twists that mesentery. Well, the blood supply is going through the mesentery, it twists the blood supply and blocks off the blood supply. As a result, the intestine will die. A large part of the intestine will die. Typical example of this, okay, and again, I've mentioned this about the last couple of years to classes that I've had. There's some bands that I like. I don't go to many concerts now because most of the people I'd want to see are dead at my age. So as a result, what happens is there's some people that I would never go see if my life depended upon it. They say, you're either going to have your left leg amputated or you got to see this band. I'll say, amputate my left leg. And one of them was the Bee Gees. I just did not like the Bee Gees. Their music, I was not a disco person. I was not a Donna Summer person. I was not a Bee Gees person. I have a sister who's 10 years younger than I am, and she was a disco person. I don't like it, okay? I don't like this stuff. Anyway, one of the Bee Gees developed abdominal pain a number of years ago. I forget which one it was because that's the way how much attention I paid to the Bee Gees. Had a abdominal pain, and it turns out they didn't know what it was. And they were evaluating him, and guess what happened to him? He died. When they did the autopsy and they opened him up, they realized that he died because he had a volvulus. The intestines were twisted around. We see this a lot like in Dalmatians and other dogs, but the intestine was twisted around and he died. Well, a number of years later, one of his other brothers developed abdominal pain. And this doesn't happen often. And the doctor says, his brother died from a volvulus. Let's see. And sure enough, he had a volvulus. They were able to untwist it and he lived. Okay. So anyway, volvulus is a twisting of the intestine, and that's what that volvulus is. Okay, a couple other things. Cholelithiasis. Cholelithiasis is a gallstone, and that gallstone then fits and it jams itself in the duct that leaves that cystic duct that leaves the gallbladder to go into the duodenum, that first portion of the small intestine, and therefore now I can't get the bile out. When people have cholelithiasis, what happens? They eat a fatty meal, and the gallbladder says, "Let me get you the bile." It squeezes, but it can't get it out because it's a stone or it's inflamed. So they can't get the bile out. It says, I'm tired, let me relax. They relax for a minute and squeezes again. So they get what's called colicky pain. Comes in waves and backs off, and comes in waves and backs off, and comes in waves and backs off. So the idea behind this is try to do something. I frequently either have to take the gallbladder out or find the stone, take the stone out. Okay, it goes a lot deeper than that. There's other things that happen. I'll mention that in pancreatitis here in a second. Cirrhosis. Cirrhosis is just a damage to the liver that occurs because of alcoholism, hepatitis, things like that. And as a result, what happens is the liver, when it becomes damaged, becomes scarred. The liver becomes hard. If you look at a normal piece of liver, it's like a dark brownish reddish color. But when I look at this cirrhotic liver, it's a tannish, a lighter brown, lumpy, bumpy, hard, really firm. And that causes some problems because the cells in the liver that do a lot of things, and the liver does so many more things that you want to think about. Makes vitamins, it makes clotting factors, makes the albumin that we talked about, all these things. The liver stops working, and that's the problem with cirrhosis. It's a horrible way to die. In fact, what happens is for many years, one of the biggest suicide drugs in England was something that you guys take probably frequently, and it's called acetaminophen. Acetaminophen Tylenol. Tylenol is exceptionally hepatotoxic when you take it in large doses. That's why they say only take this much and don't take it for this much period of time. Because what happens is the liver has to metabolize that and handle the acetaminophen. And so when people take like a bottle full of the acetaminophen, it destroys the liver, and the liver is gone. Horrible way to die. Pancreatitis is just an inflammation of the pancreas. The pancreas makes things like insulin and glucagon, which control my blood sugar. Insulin lowers it, glucagon raises my blood sugar, but it also makes enzymes. These enzymes then go and leak into the area of the duodenum to help in digestion. Well, in the case of pancreatitis, the duct that takes the enzymes from the pancreas into the duodenum gets swollen shut, okay, because of the inflammation. As a result, the enzymes in the pancreas, which normally don't get activated until they get in the duodenum, become activated in the pancreas. What it does is these enzymes leak out through the pancreas, and you start to digest your insides, your abdominal organs. And that's the problem with pancreatitis. My dad died of a pulmonary embolus, but what led him to that pulmonary embolus was he had a gallstone. He had a cholelithiasis. That gallstone came down, got stuck, and it blocked the pancreatic duct. When it blocked the pancreatic duct, all the enzymes that were in the pancreas now started to eat away his pancreas and the tissues around it. And tremendous pain. If you know anybody with pancreatitis, it's a huge, severe abdominal pain. Anyway, what happens is that causes problems. He eventually caused his pancreas to become totally eaten away. It caused him to hemorrhage inside his belly, caused a big abscess inside of his belly. And he had one surgery. In that surgery, he was in ICU for probably about 6 weeks, came home for a couple months, and then just after Christmas, that happened in like October, I believe, or September. And then finally when he came home for a little bit around Christmas time, ended up having more belly pain that went in, and the backside of his stomach was gone. Okay, the pancreas had eaten out the backside of the stomach. He had infection in the whole abdomen. Took him back to the surgery the day after Christmas, and never came out of anesthesia. Ended up with a pulmonary embolism. Anyway, that's pancreatitis. The pancreatitis is a horrible thing. Okay, people always say it's because of alcoholism. My dad never drank. His was because of a stone. But 50% of the people with pancreatitis is because of a gallstone. 50% of it becomes alcoholism. Pancreatic carcinoma, highly lethal. And the reason why it's highly lethal is it's not that it's much more, well, yeah, it's more dangerous. But the reason why it's highly lethal is before people start to get symptoms, it's usually well advanced. Okay, it involves too much of the pancreas, and it involves all the other organs downside. If people could actually find it early, which is sometimes lucky, they could do a procedure called a Whipple, where they take out most of the stuff in the belly. They just take out everything that they can, and it's gone. And that's what happens with pancreatic carcinoma. That's why the lethality rate and the death rate from pancreatic carcinoma is high. By the time they find it, usually it's very well advanced. Viral hepatitis, there's a number of different types, A, B, C, D, all the way down the road now. And these are just viruses that will cause an inflammation of the liver. And now you see on TV commercials about you could cure certain types of viral hepatitis, only certain types. And it's not that can cure it, because you can't cure a virus, but you could control it. Okay, and you can reverse some things, and that's just an inflammation of the liver. Hepatitis, hepato means liver, itis inflammation of the liver because of the of a virus. Couple lab tests and procedures. LFT stand for liver function tests. Okay, basically these are tests that will evaluate your liver function. They're mostly in this case enzymes, and when the enzymes aren't being used, they rise in the blood, and as a result, if these liver enzymes rise in the blood, it means something's wrong. Stool culture. Stool culture is where they take the fecal material and they grow the bacteria that are growing in the fecal material to see if there's a pathogenic or a bacteria that's causing a problem, like E. coli or something like that that's in the stool, and that's a stool culture. Stool guaiac or hemoccult is where they test the fecal material for blood. They just take a little bit of the fecal material, rub it on this little index, it's not an index error, it's like a filter paper, and then they could drop some reagent on there. If it turns purple, it means that there's iron in that. If there's iron in that, the iron came from the blood. Okay, so that's called a stool guaiac or hemoccult. And sometimes people will do some very early initial screening for cancers, because why? Cancers will cause some blood to be in the stool. Lower gastrointestinal series, barium minima. This is where they want to look at the inside of the colon without looking up inside. They take barium, which is like a material, and they put it in the colon. They give you an enema and fill the colon, which then makes the colon appear all white. Now, a lot of barium, some barium enemas are still done, but now they'd rather just go and do a colonoscopy. Why? Because you could see it, and if there's abnormal tissue, they could take a piece of tissue through the colonoscope, and that's a barium enema. Upper gastrointestinal series, instead of taking the barium from the bottom, they let you swallow it and bring it down. This milkshake, they always say it tastes good, like strawberry. Take this stuff; it's really thick garbage you drink, and they can actually watch as the barium goes down the esophagus, through the stomach, and out the small intestine. Okay, cholangiography. What they could actually do with cholangiography is they could give a medication, and it lights up all the ducts in the liver. Angio means vessel, graphy means an image, chole means gall or bile. So these little bile ducts, they're all over in the liver that feed the right hepatic duct and left hepatic duct, which is learned from a previous video. They could see all these ducts leading into there, and to see if there's something that may be blocking it, such as a tumor or something like that. Computed tomography, again, they could do that. That's just a CT scan. Abdominal ultrasonography, basically they just take the ultrasound and look inside with sound waves to get images. In the past, where they used to use certain types of tests where you give a medication to sort of like see the gallbladder. Nowadays, the first test that they always do for gallbladders, they do an ultrasound. They can see the stones and stuff like that in there, so that's just using ultrasound to look at the abdomen. Magnetic resonance imaging is no different from anywhere else. Liver scan. Liver scan, what they do is they give you radioactive material. Since the liver is very metabolically active, all this material goes to the liver. What happens if there's too much of that radioactive material that goes to a certain area, it means that there's cells in there that are working really fast. What causes cells to work really fast? Sometimes cancer. Or there might be an area where there's no radioactive material, which means that area is basically dead, which might be either tumor or something else. And that's just looking at, that's just a scan. Okay. A couple procedures: gastric bypass. This is where they actually make the stomach smaller. Okay. Or sometimes take out the stomach or a good portion of the stomach and hook it up to the small intestine. And that's just called a gastric bypass. Okay. Sometimes they could take a band and put around there, laparoscopic banding. They go in and put a band around the stomach to make it smaller. Therefore, you eat less. Gastrointestinal endoscopy. Again, that's either what's from the top, which is called an EGD, esophago-gastroduodenoscopy, where they could watch the tube all the way from your mouth down to the stomach into the duodenum, or from the bottom, the colon. They go up the anus, the rectum, sigmoid colon, descending colon, transverse colon, ascending colon, and they actually take the tube and get it into the area of the ileum, the last portion of the small intestine, and see there. Laparoscopy, now they could actually take and look inside, make holes and look inside the abdomen with a scope to see if there's something in there. Liver biopsy is basically, a lot of times what they'll do is they just take a needle, they numb up the side, take the needle and stick it through the side into the liver, and then they pull this needle back, and part of that liver comes out inside the core, inside the hole, inside the needle, and then when they get it outside, they sort of squish this thing out. It comes out in a long like piece, like when they take core samples of the earth or the ice, they stick a tube down there, pull that out, and that the ice or the dirt gets caught in the tube. They clean that tube out, and therefore all that material. And that's what they do with liver biopsy, just taking part of that. Nasogastric intubation. What happens is if they want to put the stomach at rest and decrease the acid, they could put a tube in through the nose, then you swallow it. It goes. I could tell you a lot of procedures about, or a lot of things with that. But they could take it, they stick it in the bottom in the nose, so that's where it's the naso. It gets to the back of the throat, goes down because it can't go up, goes down, and then when it gets down to the back of the throat, they swallow, and then you feed this tube real quick, and you put the tube down into the stomach. It's a very small tube. And they hook it up to suction all the acids and the material that's out there and stuff like that. It's called nasogastric intubation. Paracentesis. We talked about how when the belly fills up with the ascites, they could stick a needle in there and draw the fluid out. That would be called paracentesis. Okay. A couple of abbreviations. I'm going to point out the ones I think you should know. Alkaline phosphatase is basically an enzyme. Okay. I probably wouldn't ask that one, but I think it's a very common enzyme to know. Same thing with ALT. ALT still stands for alanine transaminase, which is also a liver enzyme. So when people do liver function tests, they look at both the alkaline phosphatase as well as the ALT as well as the AST. Aspartate transaminase is another liver enzyme. So I don't know if I'd specifically ask these on a quiz, but these are some abbreviations that might be helpful to know. BE stands for barium enema. That's why I stick the barium up the bottom end. Okay. BM, bowel movement. That should be an easy one one to figure out. Don't worry about this one, bright red blood per rectum. I would forget that one. I would even think about that one. CT, we know that from before. EGD, that's a good one. EGD is really simple. It stands for a long word, esophago-gastro-duodenoscopy, which means that they look at the esophagus, they look at the stomach, and they look at the intestines, or the small intestine, the duodenum, by the scope. So they go in with the scope and they're able to see those things at the gastroesophageal or esophageal-gastro-duodenoscopy. And basically, rather than saying, hey, I'm going to go in for an esophageal-gastro-duodenoscopy, you say, I'm going in for an EGD, which is easier. I take the EGD, okay? So that's what that is. So I think I would know that one, okay? I don't worry about that one. Okay, ERCP, don't worry about that. Let's see a couple more. Don't worry about fecal, okay. G-tube, I wouldn't worry about that. GB, definitely. I know GB means gallbladder, okay. Shouldn't take a rocket scientist to put that one together, okay. GERD, no GERD, no GERD, no GERD. I mean, yes, no, K-N-O-W, GERD, not N-O. K-N-O-W, no GERD. So I would definitely, that would be one I'd know. We talked about that a lot before. GI, that's a given. You should know that already. Don't worry about HBV. IBD, inflammatory bowel disease. Inflammatory bowel disease, that's a good abbreviation, IBD, because that's basically what we see in that broad category of Crohn's and ulcerative colitis. It's called inflammatory bowel disease. There's a couple more variations, one associated with certain types of arthritis that you'll get, but I would know Crohn's and ulcerative colitis as part of the IBD. Okay, I wouldn't worry about that one. A couple more here. LFT, definitely liver function test. That's a must know. Okay, NG tube, nasogastric tube. We've already talked about that. I think I would know that one. Don't worry about PEG. Don't worry about PEG. Don't worry about that. PUD, that's a commonly used abbreviation. Peptic ulcer disease. I think I definitely know peptic ulcer disease. Okay, TPM, that's sort of like on that middle line. TPM stands for total parenteral nutrition. When people can't eat because they don't want their intestines to work and they want to put them at rest for a while, what they do is they have to put in a tube that will give them all their nutrients from everything else, and that's called TPM, total parenteral nutrition. Okay, and that pretty much concludes what we want in regards to the conditions. So anyway, I'll be starting very soon and starting to add some genitourinary things to go up, there's a lot there as well. But we've now done the three videos, PowerPoint videos in regards to word roots, prefixes and suffixes, vocabulary, and now some conditions. So hopefully this will all help you. Hopefully you'll be ready to take the exam. This will be coming up later on down the road in about a week and a half. Look at the schedule. The new schedule says the next exam should be well, I won't say, because what happens is if I use this for somebody else, it'll give you the wrong date. So anyway, hopefully this helps you. Take care. Be safe.